Hello, my name is Hillary Gorson. I have a genetic condition that is semi-rare called Ehlers-Danlos syndrome. It is a connective tissue disorder similar to that of Marfan's, and it affects the collagen in your body, which is in every part of your body, your joints, your muscles, your ligaments, your tendons, your skin. One of the most severely affected parts of my body is my neck. I have something called AAI, which is atlanto-axial instability. It affects the upper two most vertebrae in your neck, C1 and C2. It is partly why I have to wear this neck collar, and it affects my vascular system and causes neurological symptoms. It's partly why my voice is a little raspy, and it contributes extremely to why I cannot turn my neck. I've been in this collar for over a year, and I was hoping to try some other treatments to not have to have surgery, but we've reached a point where that is my only option. Doctors locally in Oregon, where I am, won't do anything for me other than send me to a neurosurgeon to have these surgeries. The other condition I have is CCI, which is cranial cervical instability, and what that is my skull is also sliding off of my unstable neck. And then I have a Colt tethered cord syndrome, which is just like it sounds. My spinal cord is being tugged on at the bottom of my spine, creating more instability and pressure in my neck and back. The first thing that needs to be done most immediately is to fuse those upper two vertebrae of C1 and C2, since I am rotating at a very high degree and I'm crushing my vertebral arteries, which could cause a stroke if I'm turned for too long. We had gone out to Maryland to see this expert last October, and unfortunately my imaging had been read incorrectly, and we thought that I had a little bit more time, but I don't. The imaging had said I was rotating below the threshold, which is 43 degrees. That's when the crushing of the artery starts, and I am rotating to 44 and 45 degrees. This has become very dangerous, and I have a lot of very scary symptoms that happen if I'm not in the collar, which I had been trying to not be in the collar very much to protect my muscles, but it is too dangerous for me now, and I have to spend 24/7 in the collar. The only thing that they can do is fuse those two vertebrae, and that surgery, the deposit for that surgery is way beyond my means. We've exhausted all of our resources, and there's no one locally that I can go to for this surgery, as Ehlers-Danlos creates all these complications and has a high risk of all sorts of other, like if you go to someone who doesn't entirely understand these other conditions and how they correlate with the neck and Ehlers-Danlos, it could be extremely dangerous. So the doctors that I need to see, and there's only a handful of them in the country, are all the way back east, and they don't accept my insurance, my state insurance. They do, however, accept Medicare, and I've been fighting with disability for over 2 years, and I had a hearing, and my hearing was postponed yet again till I saw this surgeon again, and then I was rescheduled for the very end of December, and I saw my surgeon at the end of August, and he said I could not wait to have these surgeries, and my local doctors have said that I need to have this done as soon as possible, that it would be very dangerous for me to wait that long. And since I cannot even travel in winter because I have a exposed shoulder, I'm not wearing a tank top or a tube top just because it's summer. I wear tube tops year round because my shoulder cannot, even this pillow on my shoulder is bothering me. The shoulder instability has been caused by the neck instability hitting nerves and causing damage to the shoulder and spasms, and because I have this condition that creates a lot of dislocations and partial dislocations, my shoulder has had extreme trauma to it, and I cannot tolerate anything on it, which means I cannot travel in winter or I will freeze. There's no way to cover me up with a coat or sleeve of any kind, as it is much too painful. So my only option is to have this surgery before my hearing, and I'm tentatively scheduled for the very end of October. However, the deposit for this surgery is a little over $10,000, and as I said, I've used up all of the resources that I had, and the only option I have left is to try to raise enough for this first surgery, which needs to be done immediately. So anything that you can do to help, just even passing this video on or donating $5 or more would be so incredible to helping my mother and I and my caregivers go out for the 2 weeks it takes to have the surgery and the follow-up for these rare spinal conditions. So thank you so much for watching my video, and please pass it on. Thank you.